Wolters Kluwer journey so far started 185 years ago, where we were actually publishing textbooks for school children in Holland. As we fast forward to where we are today, there's been many numbers of transitions of our business to adapt to the environment. We're now providing millions of professionals knowledge information in their specific areas of expertise. And this is a real shift or a digital transformation that's kept us very much current in the environment that we're all operating in today. The COVID period for Wolters Kluwer was a very challenging time. Having said that, it gave us a real opportunity to step up and support our customers and the community. To give a couple of examples, during the height of the pandemic, Wolters Kluwer's made our tool, our specific clinical decision support tools, available globally to any clinician free of charge. This was something that was not done from a business perspective. It was done to ensure that we were supporting the community during this tough time. If I think about our customers, again, it was an extremely challenging time. Clinicians working around the clock to try and get on top of the pandemic. Where I feel very rewarded is that we were able to support many institutions, many clinicians, and many people in the healthcare industry to support their patients and try and get through this very troubling time. There's a number of challenges in acceptance of clinical decision support systems during COVID and even post-COVID. During the pandemic, it was very difficult for organisations to implement any new technologies. So frankly, what they had at the time is what they were able to leverage to help them support them through the difficult time. What we did find, however, that the institutions that were using clinical decision support systems had some advantage in the fact that on a daily basis, there was new evidence-based information coming through the tool to clinicians to help them deal with a very much unknown disease that we were facing globally. So digital health, it's a very interesting term, and it means many things to many people. So one of the things that we have to first determine is what is it that we mean by digital health. In the terms of clinical decision support, digital health really is about how are we delivering evidence-based information to the healthcare industry through various technological enablers. These could be through an EMR system for hospitals that have a more technological infrastructure, or it could be as simple as providing that information onto an iPhone or a tablet. In many areas where we talk about digital health, we're starting to partner with more and more telemedicine organisations that really were born or accelerated their growth through the COVID period. We found that many of these organisations were able to help particularly rural patients, and during the COVID time, it was not ideal for patients to go to hospitals when it wasn't absolutely necessary. This really helped the whole digital health architecture to accelerate in its development to where we have it today. So patient safety is one of our key principles and a major focus for us at Wolters Kluwer. As WHO talks about today, they talk about a patient-centric model, which is something that we've adopted within the Wolters Kluwer infrastructure. So the journey really starts as we work with medical students throughout their learning journey to becoming clinicians in the health industry. We found the feedback that the ability for us to help students learn quickly and become very familiar with what we call point of care solutions, being able to have the answers to the questions that have been given to them by their patients at their fingertips. In fact, we know that around 60% of questions during a consultation go unanswered if they're not using clinical decision support systems. Now, as we move into the patient journey, if you think about as a patient enters an emergency department within a hospital, Wolters Kluwer's clinical solutions is with the patient for the entire length of their journey, from the time they enter the hospital into triage. There's critical decision points along the way until that patient is finally discharged, that we have solutions, whether it be from a clinical decision support, a drug referential decision, or a drug alerting solution. So we really are with the patient for the entire journey until they're finally discharged and on their way to a healthy recovery. We get asked lots of questions about what's required in order to implement a CDS solution. And frankly, there's a number of myths around what is needed for a clinical decision support system. And the first question typically is, what sort of infrastructure do I need? Do I need an EMR system? And quite simply is a clinical decision support like UpToDate requires no infrastructure within the hospital organisation above and beyond what they may have today. In fact, we can actually turn on our solution and immediately give access to any of the healthcare workers within the hospital environment, either through their iPhones, their tablets, or if the hospital does have an EMR system, we can also integrate with that, but it's actually not necessary. Some of the other myths that we have around clinical decision support are around things like, oh, is it going to replace me as a clinician? And I'd have to say, it couldn't be further from the truth. Our tools are there to provide knowledge information to clinicians at the time of point of care. And it's a really important thing to remember. None of these tools will actually replace clinicians. They're actually there to enhance and support them during the time that they're sitting with their patients. The future growth for Wolters Kluwer in the healthcare sector is a very exciting space for us. Post-COVID, what we've learnt is that, or what I should say our customers have learnt, is during those challenging times was when they really needed tools like UpToDate or clinical decision support systems. So our growth plans are quite simple. One, we need to educate more students whilst they're on their learning journey to be able to use such tools in a point of care situation. Secondly, we need to expand our footprint across the region, and more specifically across India, which is one of our fastest growing countries in the region, to ensure that we can get clinical decision support tools in the hands of every clinician and healthcare worker. What's the outcome of that? The outcome is a better patient outcome or a better patient journey, and it also ensures that we are reducing the unwanted variability of care across the globe. So thank you. It is our 30th year anniversary, and what a journey it's been. If I think back to Bud Rose, our founder, who developed the UpToDate tool, starting with one speciality, and in fact, it was built on a floppy drive. As I look back and think about where we've come from those early days to developing the tool that we have today, a tool that's used by millions of clinicians globally, a tool that is accessed more than 54 million times per month. If I think of Bud Rose looking down, very proud of what we've achieved in building on his legacy. Our mission is to reduce the unwanted variability of care, and our mission is to have clinical decision support in every hospital in the hands of every healthcare worker. And I look forward to the next 30 years to see where that journey will take us.